Good afternoon. I'd like to call to order Health and Human Services and Aging Committee, 104. And can we have a roll call, please?
Calling the roll, Ms. Conwell. Present. Mr. Jones.
Here.
Ms. Brown. Ms. Brown is absent at the moment. Mr. Miller.
Here.
Ms. Stevens. Ms. Stevens is absent at the moment. We have a quorum.
Anyone signed in, Madam Clerk, for public comment?
No, Madam Chair, no one is signed in.
Ms. Lou is not here today? Oh, all right. I would like to make a motion to approve the minutes for the July 17th, 2019 HHS meeting, as well as our joint committee meeting with education. Is there a second?
Second.
Moved and seconded. All in favor say aye. Aye. Minutes have been approved. We do have a couple of committee members that are running late, so we will get started because we have a healthy agenda today. If you could read the first matter referred to the committee into record.
Resolution number 2019-0176, authorizing an amendment to master contract, which includes numbers CE 1700245 through CE 1700265 with various providers for various services for the Cuyahoga Options for Independent Living Services program for the period 1/1/2018 to December 31st, 2019, to remove various providers and for additional funds in the total amount not to exceed $609,026.
All right, and every speaker today, please state your name for the record.
Hi, Councilwoman Conwell. Paul Porter. Paul Porter.
Good afternoon.
Good afternoon. I'm introducing this item as an amendment to the Options Master Agreement, which is for additional funding for 2019, as well as to acknowledge two vendors that discontinued providing services under the Options program. The first was Benjamin Rose Institute on Aging, which discontinued their homemaking program entirely. And the second was the Visiting Nurses Association. Due to a low client count, since they had only signed up to deliver personal care services and not homemaking services, they indicated that continuing to provide services under this program wasn't in their best interest financially. So both of those vendors are being removed. This is an amendment to the master agreement similar to what we did towards the end of last year, where we had to add additional funding due to increased demand for services. Last year we did an amendment for $740,000. This year the amendment is $609,000, so a little bit lower than the amendment amount last year. And we did some analysis of the increase in demand between the middle of 2018 and the current point in September 2019. And what we saw, which we forecast last year, the reason for adding the dollars last year as well, was an increase in most of the services demand-wise. So that went from a 10% increase in homemaking, which is next to emergency response, the most utilized service, a 22% increase in the number of clients getting home delivered meals, an 8% increase in emergency response client count, a 12% increase in medical transportation. And then for personal care, since that was a service that we just reintroduced to the contract last year after having not included that in the past several years, we saw an increase from 34 clients to 91 clients. So that actually represented percentage-wise a 168% increase, but that was largely due to the fact that we hadn't been providing the service. And since we were kind of getting back into the groove with referring new clients to those providers, the other services already had kind of a steady base of clients that they started out the year with, since this is an ongoing program. So looking at the increase in service demand, we're adding dollars for this year, and we do intend to come back with another amendment prior to the end of the year to exercise our option to extend this contract for a third year. When the contract was put into place in 2018, it was a one-year agreement with 2 option years. So we're in this the first option year right now, which is the second year of the contract, and we intend to exercise the option to extend the contract via amendment before the end of the year. One of the things that we're contemplating next year in order to increase the number of vendors that are involved with the contract is doing a request for qualifications or an RFQ rather than an RFP. Part of the logic behind that is we already know what the option services look like. For an RFP, you're asking providers to design a new program. For an RFQ, we can be fairly prescriptive about what the services should look like. Homemaking should not differ much from agency to agency. Home delivered meals should not differ much from agency to agency. So if we define the terms of the services fairly specifically in the RFQ and then ask the providers to submit their qualifications and the rate they would charge for each of those services, we think we're likely to get an increased number of vendors able to provide the services. Where for the RFP, we had some providers that may have done a good job delivering the service, but didn't do a great job responding to the RFP. They had proposals that scored poorly during our evaluation process. The evaluation for an RFQ is a lot different because, again, you're not asking somebody whose job it is to deliver home care services to craft, a proposal dozens of pages long about the program they would develop. I'm happy to answer any questions about this amendment, and I do want to introduce from the Division of Senior and Adult Services, if you have any questions more from the programmatic side rather than the contract side. DSAS is represented today by Administrator Tracy Mason, Deputy Director Darlene Wade, and then Options Program Manager Cynthia Mason. So if you'd like for them to come up for any questions, I just wanted to introduce them first.
So I'm going to open it up for my committee. Councilman Miller?
Madam Chair, Mr. Porter, how much money are we getting back because of the two that are being removed?
At this point, because they had clients that were referred to other providers, it's not necessarily dollars that are being removed from the contract. Since this is a master agreement, we were just able to move those funds around to other vendors. It wasn't a scenario where we had to amend the contract to remove those dollars, just a simple decertification process and then a recertification. So those dollars will still be used just for other vendors.
Okay, thank you.
And so there was a difference of last year, Paul, you stated 740 compared to the 609. So why did it drop?
Sure. So when we came up with this $609,000 number, we were looking at what utilization had been throughout the beginning of 2019. Part of the reason that we saw increased demand last year was because we removed a lot of clients from the waiting list. So demand spiked towards the end of last year. We exercised what we call a managed enrollment process through the first part of this year. So we would include some attrition in the number of clients that were rolling off the program and then enroll clients based on that attrition rate. However, the number of clients that were more interested in options exceeded the number of clients that were dropping off as far as the rate of attrition goes. Once we realized that and that the waiting list was kind of creeping back up, we removed clients from the waiting list and we're down to 75 clients left that are waiting for homemaking services. We're removing them in batches of 15, but the fact that some people were added to the waiting list during the first 8 months of 2018 led to us kind of underspending compared to last year.
So there's still funds that need to be.
There are funds, yes. So, and we anticipate that this 609,000 should take us through the end of this year. And then our budget request for 2019, the reason we're having to do this amendment is because the initial allocation of 2.1 million was the same as the initial allocation in 2018. It's anticipated that the amendment we bring back for 2020 will be higher than that $2.1 million figure in order to account for the fact that we know we're going to exceed that based on client demand.
Okay, and so if you come back with that budget request, will it also eliminate the waiting list?
I might defer to Tracy on that and see exactly what we anticipate doing. Our goal at this point is to have eliminated the waiting list for this year, though, by the time those homemaking clients are referred.
Yes. Good afternoon, Councilwoman Conwell. We do anticipate on eliminating the waiting list. However, we recognize that this is a program where the demand will always outweigh the resources that we have available. And so as we promote and share the program, we do anticipate that we will always have a waiting list in some form of fashion.
Is there any way to project or increase the budget enough where you could project, not to have those we hate hearing waiting list. 'Cause it means that
And
people
so
are
do
not-
we. So do we. When we know the demand is out there, we are going to be proposing in our 2021 budget year for additional $800,000, so we can make sure we have a case management load of 1,500 clients in the program at any given moment. With this increase of $600,000, it will allow us to maintain a caseload of 1,200 clients.
Okay. Any other questions for the director or Mr.
Just for clarity,
Councilman Jones?
thank you, Madam Chair. For clarity, the universe is 1,500. We're at 1,200, but the universe is 15.
Yes,
Thank you.
that is the goal.
Hearing none other, thank you both for coming. Thank you all that have come from DSAS. We will move this, Paul, second reading suspension.
If we could, please, this item has a 9/1 start date to have the dollars added. And I hope that it would have appeared on the August agenda, so we're a little bit behind on that. If we could have the second reading suspension, that would be great.
Okay, and when will you start the RFQ for next year?
Our anticipated date for that is sometime in the spring, and then it would be a 1/1/2021 start date. So that'll occur in the spring.
All right. If someone can make a motion to move this to the full committee for second reading suspension?
So moved.
Second?
It's moved and seconded. All in favor, say aye. Aye. All right, thank you very much. Madam Clerk, if you could read the next item into the record, please.
Resolution number 2019-0209, authorizing an agreement with Cuyahoga County Prosecutor's Office in the amount not to exceed $2,748,203 for legal services for the period 1/1/2019 to December 31st, 2019.
Good afternoon, Paul Porter again, County Division of Contract Administration and Performance, on behalf of both the Prosecutor's Office and the Division of Children and Family Services. We're moving this item forward, and this is the annual contract that we have to fund a dedicated Children and Family Services unit of the Cuyahoga County Prosecutor's Office. These attorneys provide legal representation and counsel to DCFS in cases of abuse, neglect, or dependency matters. This contract funds managing attorneys, assistant prosecuting attorneys, paralegals, legal secretaries, and they are assigned to the specific unit at DCFS, representing the Division of Children and Family Services at hearings, handling filing and drafting of complaints and necessary motions, preparing witnesses for trials, handling subpoenas, pretty much anything to do with legal representation for the county in cases of abuse, neglect, or dependency matters. This is an agreement between two government agencies, so there wasn't a competitive procurement process for it. This is an exemption. The value of the contract is $2,748,203, which represents an increase over 2018. And the funding source for this contract is 67% HHS levy dollars, 33% federal dollars under Title 4E. Included in this increase are two new APAs that were added in an effort to reduce caseload sizes. Filings have continued to increase in both 2018 and 2019. And we anticipate, we're working on negotiations for an agreement for 2020 as well, recognizing that we're into September before this agreement for 2019 is approved. The staffing increases are supported by both DCFS and the prosecutor's office. One of the reasons for that is even just comparing caseload sizes for attorneys between our county and their counterparts in Lorain County, where our caseload size averages about 108. In Lorain County, it's more like 40 or 50 per attorney. So there is a disparity there. And between 2016 and 2018, there was a 100% increase in filings that these attorneys were having to make. So virtually double the workload just in the past few years. Again, we're working on the item for 2020, and I'd be happy to answer any questions about it from a contract perspective. Michelle Myers is also here from the prosecutor's office if you have any questions specific to their work at DCFS.
And open it up to any colleagues. I did have one. The figure increase over the years. I know you were saying it was as kind of like government to government, but due to the increase of the filings, they have went up for the contract price since last year. Correct?
But that wasn't necessarily just because of the filings. It was to help offset the cost of adding the new APAs to account for the increase in filings.
How many new APAs do we have?
So there were 2 added in 2018, and I believe 2 more in 2019. So that's part of the reason the funding went up 6% in 2018, which helped account for hiring new APAs then as well. And then there was the increase for 2019 too.
Okay, so basically due to the filing. I think you have someone that wants to come up. Okay.
I just wanted to correct something that Paul indicated.
Put your name on the record and,
Michelle Myers, I'm a supervisor with the prosecutor's office of the unit, the CFS unit here in Cuyahoga County. Madam Chairperson, I just wanted to correct something that Paul had indicated. We did not add 2 people in 2018. The only people who were added were in 2019, and that was 2. And that was per the council's approval of an increase in the budget at that time.
Councilwoman Brown.
Thank you. Can you just indicate the number of filings from last year to the increase, how many there were actually?
So when we did the request in August of 2018, the numbers had gone up from January 16 to August of, I'm looking at the wrong one, I've got 2019 numbers. They've continued to rise. So in January of 2016.
Excuse me,
there
Ms.
were
Myers,
7
can you speak into the microphone, please?
I'm sorry, the microphone. Thank you. So in January of 2016, our records indicate there were 1,757 children in custody and 388 children in protective supervision. By July of 18, just 2 years later, there were 2,406 children in custody and 706 under protective supervision. So those protective supervision numbers are the ones that rose dramatically. With regard to just as recently as Monday of this year, just of September 16th, there were 2,863 children in custody. So you can see we went from 1,757 to 2,863. Just custody cases, excuse me, and protective supervision cases went from 388 in 2016 to just this last Monday, 761. So that's the dramatic kind of increase we're seeing. Social workers are seeing it, obviously. I know that you've talked to the director of HHS and the director of CFS about that, but our office, in representing them, are seeing the exact same thing. So that's why we are working now on the next budget to include more APAs and more support staff so that we can support the mission of Children and Family Services as much as possible. Because even between the last request in August of 2018, and now the numbers have increased 400 children. So I have prosecutors who are handling 150 to 200 cases. It's just not feasible to do your best work. So that's why we're looking to increase that.
So you're looking to increase to what? Well, under
I don't have the
APAs.
numbers before me. We did submit those to OBM. We had originally asked for 8 positions. We got 2. We are asking for those other 6. So I believe the numbers that were submitted was $3,967,479 for 2020, and then $4,046,716 for 2021. And those were submitted by our office to OBM to talk about the contract that's coming up. And that would allow us to fill those positions that were not approved in 2019.
Okay, thank you. Thank you, Madam Chair.
All right, any other questions regarding this contract?
No.
All right, I think that covers it. Anything else you guys would like to share? Would you like this in second reading suspension?
Yes, if we could, please, that would be great.
All right, I'd like to make a motion to move this to the full council under second reading suspension for 0209. Is there a second?
Second?
It's been moved and seconded. All in favor, say aye. Aye. Thank you both very much. Madam Clerk, if you could read the next item into the record, please.
Resolution number 2019-0210, authorizing a contract with United Way of Greater Cleveland in the amount not to exceed $1,095,450 for fiscal agent services and emergency food assistance to eligible Cuyahoga County residents for the period 1/1/2020 to December 31st, 2020.
Good afternoon. My name is Julie Schaefer-Wisniewski. I'm presenting on behalf of Cuyahoga Job and Family Services. This is the contract with United Way for the coordination of funds for emergency food purchases. The contract begins on January 1st, 2020, and goes for a full calendar year. The purpose of the contract is for United Way to provide professional services related to coordinating the allocation of funds for the purchase of food by the hunger centers serving eligible individuals and families residing in Cuyahoga County. The United Way provides administrative oversight of the county funds, which are dispersed to the Hunger Network's 36 agencies. United Way collects a 0.5% administrative fee, which totals $5,450. All other dollars are distributed to the Hunger Network's agencies. United Way was asked to administer these funds because of their unique position as a recipient of local FEMA dollars for emergency food and shelter. The total value of the contract that is being presented is $1,095,450. This amount has remained flat for the past 7 years. I'd like to note that United Way has not requested an increase since the beginning of this partnership. It was last procured in 2010 when this partnership between the Hunger Network, the Food Bank, and the United Way was created. Funds are allocated based on community needs. The Hunger Network is currently updating their allocation formula. I'd just like to highlight that some of the areas most frequently served are the Detroit Shoreway, Old Brooklyn, Slavic Village, and Miles Union. And for adults 60 and older, the Garden Valley neighborhood, Lakewood, and the Redeemer Crisis Center. There are representatives here today from all 3 agencies. I can answer all of the contracting questions. If you have any programming questions, they're here for those questions.
Would you like to introduce who's here in the audience?
Yes, the Hunger Network, United Way, and the Food Bank. Yes.
All right, well, welcome and thank you for coming out. This is a very important contract, not that they all aren't, but this is very near and dear to all of our hearts, is to make sure that our neighbors have the food and the funding that they need to help those that are in need. None of us know where we may be, and I'm sure if we ever had a natural catastrophe, we should be very fortunate that we have a food bank that could really help each other out in that time of crisis. So I will open it up to any questions, Councilman Jones.
Madam Chair, I'm actually almost scared to ask this question, but yeah, you've already said it. For the last 7 years, you have not asked for an increase. Why not? What has happened? Why have you been able to just keep it flat for 7 years? There's never been an increase.
They've been able to operate on that amount. Maybe, Ben, could you speak to the funding? But
I did not
I've
mean
not
to
heard a
open the
complaint.
can of worms, but I know.
So remember that during budget.
Hello, Ben Millidan, Director of Health at United Way of Greater Cleveland. Good question. We have certainly had some discussions about whether that would be an appropriate request. I think especially over the last couple years, we've had some discussions on whether or not the conditions were favorable for that, whether or not we were demonstrating full and complete efficiency on that. We are grateful that the contract has not been cut, obviously, because we recognize that the county is always in challenging fiscal times and is trying to make the best use of dollars. So I think that's an ongoing discussion, and one that we are, as all three partners, the Food Bank and the Hunger Network and United Way, are interested in having in the not too distant future. And you might be hearing from us about that soon.
Can you speak to, at this moment, the vendors, what their level of resource need might be?
For that, I would probably defer to the Food Bank and or the Hunger Network, especially Jennifer. Do you want to discuss?
Good afternoon. Familiar face, Jennifer Schofield for the Hunger Network, Madam Chairwoman, members of the council, or of the committee. We have, as the kind of on-the-ground partner in this true partnership with the Food Bank and United Way, are always grateful for the support that the county has provided for many years on this. I think someone would probably call me foolish if I came up here and said we could not still do more with more resources. We worked very hard over the last several years to really build efficiencies and build collaboration into this work. We recognize the value in the work. I think with additional funds, we could expand the hunger centers that we're able to support. As was mentioned, we're currently in the progress of evaluating where we're making investments. Are we continuing to meet all the need in all the communities that we best can? And that's underway, and we'll have more information by the end of the year on how we want to do that. It's hard to put a number on that, but if there was something to increase so we could increase our service, I think everyone would be grateful for that.
Hi, good afternoon. My name is Jessica Morgan. I'm with the Greater Cleveland Food Bank. Thank you for the opportunity. I will just build upon what Ms. Schofield said. We are also seeing a rise in food and freight costs. We are currently looking at some data at the food bank and trends over the last several years to also help us put some data together for this committee to review in the not so distant future.
Okay, thank you.
All right, any other questions? Councilman Miller.
Do we know if the actual demand for food assistance is continuing to go up at this time?
Through the councilwoman to the council member, yes. And I would also suggest that the need, while it remains concentrated in the east side neighborhoods of the city of Cleveland, it is moving. In the work that we did last year with Dr. Mark Salling at Cleveland State, you might know him. He is a GIS researcher there. The movement is concentrating in the northeast to southeast inner ring suburbs. So if you're looking up Euclid all the way down into Garfield Heights and into Parma, you're seeing movement as poverty, unemployment, or employment, SNAP eligibility, all of that moves. As we know, it moves around. So we're seeing an increased need in that part of the county in particular. But through that work, we're also noticing tiny incremental changes in the outer suburbs, but noticing where there is some change and some growing need there is a lack of resources. So if we wanted to try to get ahead of this a little bit and be a little more proactive, we could see a need to make some investments a little farther out and try to get ahead of that curve and plug some gaps before it becomes too urgent.
Madam Chair.
You done, Councilman Miller? Councilman Jones?
Thank you. So we've seen an increase in cost and in need. You mentioned Garden Valley a little earlier. Could you repeat? I just didn't catch what reference was made around the
I
Garden
think
Valley.
that was the senior 60 and older. They see a larger population at Garden Valley, but Garden Valley sees a huge population at that center. They see a lot of people from kind of all over.
Is it one of the largest or the largest? How would you characterize it?
It certainly has a high volume. I mean, it receives, pardon?
The Garden Valley Neighborhood House out of the Food Bank 6-county service territory is our largest food pantry
It is the largest.
in all 6 counties that we serve. Yes, and that goes for food distributed and number of people served. Yeah.
It's in my district. I just want to brag on them for a moment because they also have a gentleman, Durham Construction Company. And as individuals, families come for the food, they pick from the population, those who need help in being apprenticed in all of those trade skills. Tuck point chimneys and all the trade skills. They've been in business for 75 years. So it is a great intersection of human services and job creation. Many of those individuals go to the unions, the building trades. They fill our targeted goal numbers of low income that need to participate on many of the projects downtown, and they come as a pipeline right through that for that food pantry. So
Yes,
they
the
certainly
food pantry now operates under the construction, under Durham Construction.
Durham Construction, yes. So, thank you.
Any further questions? Thank you all for joining us today. Hearing none. Julie, are we requesting a second reading suspension?
No
Or this can
suspension
go-
needed.
Huh?
No suspension needed.
Okay. All right. Thank you for coming out. I would like to make a motion to move 0210 to the full committee for 3 readings.
Second.
Moved and seconded, and all in favor say aye.
Aye.
Thank you very much.
Thank you.
Madam Clerk, if you could read the last item into the record, please.
Resolution number 2019-0211, authorizing an amendment to contract number CE 1600299 with Oriana House for operation of a nonstop reentry resource center for the period 1/1/2017 to December 31st, 2019, to extend the time period to December 31st, 2020, and for additional funds in the amount not to exceed $600,000.
All right. Who's here to speak on this?
Councilwoman Conwell, had there been any outreach from the Office of Reentry on this item prior to the meeting? Okay. Well, our office was involved in proposal evaluations for the RFP that was done for the Reentry Resource Center recently. I know that there was no one proposal that stood out in that process that, we had full confidence in issuing funding for the Reentry Resource Center based on that. So the decision was made to make an amendment to the current contract with Oriana House and then to go out for another RFP, I believe next year on that is the goal. So that we would amend the current contract so that there's no interruption in services, but that the RFP itself would be revised, hopefully to elicit some better responses. I can't speak to anything else about the Reentry Resource Center itself right now, just the reason that we're doing an amendment instead of a new contract agreement effective 1/1 next year.
All right. Any questions for Mr. Porter? Councilman Miller?
You're saying that you're looking to get more responses to the next RFP. Does this mean that you're dissatisfied with the current services being provided?
Councilman Miller, not at all. And in fact, go ahead, Julie. Yes.
Julie Schaefer-Wisniewski. I actually wrote the RFP with the help of the Office of Reentry. And we had limited information as far as capacity utilization and such from the Oriana House, who is the current incumbent and the current provider of the Reentry Resource Center. We issued the RFP, we received 3 responses, all of which did not necessarily meet the need. Some, of course, were above and beyond what we could afford. And so we went back to the drawing board and decided we are going to use the analysis currently being done by Case Western on that specific program, and they're going to help us craft the next RFP. I know they currently offer a wide array of services, scheduled programs as well as walk-in. We thought they were, Office of Reentry felt that they were doing a good job to amend. And for 1 full year, we'll reissue the RFP again with the help of Case Western that they currently have a contract with. And we'll see what types of responses we get next.
And Madam Chair, the 3 responses we got, was Oriana House one of the 3, or were there 3 completely new responses?
We received 1 from Oriana House, 1 from a national program that was very expensive but very nice, would have been wonderful, but beyond our budget, and then another smaller local program that would serve much smaller capacity, unfortunately.
Okay.
And I'd be happy to share those score sheets with you. As you know, our office does a comprehensive and thorough review of all proposals, so I'd be more than happy to share those. At another time, I don't have them with me today.
All right. Any other questions? Paul or Julie, what do you recommend? Second reading suspension or 3 readings for this?
I believe
This
it's
contract doesn't expire yet. No.
Okay.
So
No,
I
thank
think
you.
we can do 3 readings
Yeah,
for
3.
this one.
All right. Thank you both very much.
Thank you.
I'd like to make a motion to move 0211 to the full council for 3rd reading. Is there a second? Moved and seconded. All in favor say aye. Aye. Thank you very much. Thank you, everyone, for coming out. To continue on our agenda for today, we have 2 presentations, and so I'd like to bring up the individuals from the project Metanoia to come up and present their project today. If you have anyone that is not coming up but is in the audience, please recognize them. And Health and Human Services, will give you a little bit of touch of the heart when you come to this committee, because we talk about food. We're about to talk about individuals that are not blessed to live in a home right now. So you always get a little touch of the heart when you're at this committee. So please continue, state your name.
Megan Crow. I'm the executive director of the Metanoia Project. Forgive me, I'm just going to be brief. I just had surgery yesterday. In Cuyahoga County, we rely on the data of a point-in-time count for unsheltered homelessness, which is done in January. And the last data we got was that there were 106 unsheltered adults in Cuyahoga County. Me and the gentleman standing behind me are pretty aware that those numbers are not accurate of what's really going on, and would estimate that it's at least triple that amount. That's not what we're here to talk about today, but I just want to highlight that unsheltered homelessness, meaning that people are actually sleeping outside, under bridges, in tents, in alleyways, is a problem. And we at the Metanoia Project have been working very intimately with this cause for the last 12 years. One of the co-founders is here today, Jim Schlecht. And we know that there are a lot of services in our county that that do a really excellent job of providing shelter and basic needs for those people that are experiencing homelessness. What we have learned is mostly about unsheltered homelessness, and in order to approach that problem, we have found through a lot of trial and error and a lot of really hard work that that it takes a different paradigm and a different approach. Over the last couple years, we have seen our numbers increase dramatically. Just at our hospitality center, we provide overnight hospitality to, on average, about 110 men and women, both men and women, per night in the winter months. And we have come upon a new, very successful way of working with the unsheltered homeless. Today, we're here to share some of that success and to give an overview of what we do, and hopefully you all can get an idea of what kind of programming has been really working for the unsheltered homeless, those folks that have fallen through the cracks of the rest of our system. So without further ado, I will present Jim to speak a little bit more on that.
Thank you, Meg. Good afternoon, everybody. Just want to thank you first off for the opportunity to just share a little bit about the Metanoia Project, because I'm sure a lot of you aren't aware of what we do and our importance. And I just want to take a couple minutes to give a brief history to understand how the Metanoia Project came about and how it was created to deal with systemic gaps in our present network. I am a street outreach worker with Care Alliance. I've been with them since 1998. And at that time, it was known as Healthcare for the Homeless, one of the 10 pilot programs the federal government, Yvonne knows well about this, to address the medical and social service needs of folks who are sheltered homeless, but more specifically, folks who are unsheltered homeless. So what we've been doing in the last 21 years is going out 3 mornings a week to the campsites, under bridges, in bus stations, and that, visiting folks who are unsheltered homeless, who for a lot of reasons, and we won't get into that now, will refuse to go to the shelters. And our medical director at Care Alliance suggests that 85% of the persons who are unsheltered homeless have suffered from severe trauma. So understanding that, it is of crucial importance for us to enter into relationships in a very compassionate, non-judgmental way, really trying to get to know people as we take survival items to them. So we did this for 5 or 6 years, and it became very difficult every winter to go home and sleep at night and know the names and the stories of people who are staying outside who may not survive the night. And in 2006, the then commander of the 3rd District, Andre Gonzalez, convened a meeting of social service providers, politicians, people from the business community, to address the issue in a creative way of unsheltered homeless. At that meeting, we suggested an overnight hospitality center that would have no barriers, where people could come in all night and be out of the cold. And that basically began the idea of the Metanoia Project. And in 2007, we opened up during the winter months at St. Augustine's Old School Building. At that time, we housed 40 people, many of them based on relationships that we developed with people on the street during the year. Our numbers in that time have increased to, we're averaging over 110 persons. And just to give you an example of how we've tried to identify the barriers, we are the only overnight center that takes both men and women, because we found out that we were seeing couples on the street who would rather stay out when it's 5 below zero and not separate. So while they can't sleep together, they can come into our hospitality center. I don't like to use the word shelter because I think we're more welcoming than just providing a place to stay. And what we've tried to do as things have evolved is, because it is such a transient population, we bring services in. So we're not just providing a place to stay, we're providing meals. We have Metro Hospital that comes in on Friday nights to provide medical services. We have Care Alliance on Sunday nights. Paul and I do a housing resource program. And as a result of that, and as a result of the relationships we've developed, we've seen many of the folks that have come in seeking shelter have really transitioned, have actually made metanoia, which is a change of mind, transformation. We've seen that happen among many of the people that have come in. And some of those people have the following year come in and have volunteered and also become part of our staff. So as the numbers have increased, though, we've really run into a dilemma in terms of keeping that as a relationship model. So last fall, and I'm going to let Paul, our previous board member, address this, but we decided to open up what we call a satellite program. And at that point, I'll let Paul take over.
Hello. Hi, Paul Sherlock. I am past president of Metanoia, have been involved with the organization for the last 7 years. When I started, we were housing or sheltering or hospitality center for about 40 people. And as Jim indicated, we are now at around 110 on average. So we've been seeing this increase and seeing a need to find additional space, other space for our operation, because we are quickly outgrowing our current location, which is at the Malachi School. And so, as Jim indicated, last year, he came up with the idea to open a second location, which was at the Catholic Workers House. And that was in part because some of the guests, some of the folks that we work with were commenting that they were seeing us turn into more like a 2100. They were not seeing a lot of difference, and that was partly due to overcrowding. And we had, as I said, we had been starting to look for a space, and when we opened up the second location at the Catholic Workers, we had a total of 13 people that came through. 13 people at any one time come through it. It started slow at first, and by the end there were 13 people coming through our doors over there. And it was, again, primarily harm reduction. But what we saw as a result of a small group of people, along with a staff member, that deepened the relationship among everybody that was there at the Workers' House. And it became very empowering for people. It became very democratic. Everybody had a say in how business was going to be conducted there, what meals they were going to cook, if other people were coming in, do they accept them, do they not? We had a couple of people that were very difficult cases at our main center at the Malachi School that we had to suspend for a period of time. The folks, everybody that was gathered at the Workers' House invited them in, made a decision to invite them in, chose to invite them in. And these folks that were acting out at Malachi came in and they became model citizens. As I said, the emphasis was on harm reduction, but what we saw was really what Metanoia exemplifies, which is transformation. Of those 13 people, 8 of them got into housing and are maintaining housing. One of those 8 also went through treatment and is still sober today. So when we were thinking about, okay, what do we do about finding another space, it dawned on us, why don't we explore this, what we call the satellite model? Instead of centralizing everybody, we have groupings, smaller groupings of people with staff alongside them, and the ideal, where we'd like to take this is to have these small groupings of people in locations throughout the city, throughout the county. We see this as a very positive way to make differences in people's lives. Now, all the while that this has been going on, we got word from St. Malachi that we have to reduce our numbers down to 45 at their location. So suddenly we have this need to account for 65 people. The difference between the 110 and the 45. So what we have explored throughout the summer is a relationship with the United Church of Christ on Denison. Reverend Nozomi over there has been very gracious, very open to having us come to her church. So I touched on what the ideal is, but now we need to deal with the necessity, which is to get these people under shelter and reducing harm for them. So we have sort of a hybrid of the satellite model, which is at the UCC Church, we want to split, we want to create 3 different groupings of people so that we can have that small, intimate relationship amongst them in 3 different parts of the building. It's moving towards where we want to eventually take this. What we have now, though, is 2 locations, 2 rents, and now we have to add in transportation, and we're adding staff. And so what we're coming to the county for is some funding to support that effort. Our costs are increasing. We've been soliciting revenue sources from everybody that we can think of. We are still short, and we are asking for $100,000 from the county to help support our efforts. So at this point, I don't know, David, current president of Metanoia, if you have anything to say.
Good afternoon. As Paul said, I'm David King, the current president. And just to kind of bring this home, there's a word for what we do, and that is, just to get it right, because I am no scientist here, it is psychosocial rehabilitation. And we know this because of the hard work that Megan has put in to looking at what we do and giving it a name. And it's all about the relational stuff we talked about. I mean, this is just a way of meeting people where they are and getting them to the next level. And that's what Metanoia really wants to do. So you've heard about the history of what we've been through. You know what it is we're trying to do. And we see some real advantages here for the county. I mean, we are there to shelter these people who otherwise won't come inside because we've made that relationship. And there's a real benefit to to the community at large for that. And then in providing this, we're also doing bringing these people to become better members of the community. I mean, they are now able, when they are dealing with us, to interact with one another, to, as Jim pointed out, maybe become parts of the process, and even on to becoming workers for us and moving on. And then these people move on to be better consumers and maybe even providers, as we pointed out. So we freely are sharing our successes with the greater community. Oftentimes these successes aren't apparent at our level, but become apparent as they move into other resources in the community. And we also are able to gauge, again, what works and how people can be brought up out of the lowest portions of their lives and existence into something that's far more healthy for them and the community at large. And for that reason, we're looking to partner with the county in many ways, not only with the money, but also to be aware of what's out there. We do try to keep our employees very trained in what's available so that they can then lead our guests where they have to be, but also in providing the results and the methodology so that we all move forward to a better place. Thank you.
And with that $100,000 request, is that ongoing or one time?
That's certainly an ongoing thing. As you've heard, we are looking to a future where, unfortunately, we're looking at a past where homelessness and unshelteredness is growing. And we're looking to be able to provide this. We're at one spot last year. We will be at 2 spots in this upcoming season. And we hope that we can be in more places to provide this for more members of our community, because they're out there. That 106 people that the county recognizes in the one-time count of the unsheltered really isn't that number. And if we provide other spots out there, we're confident we will find a lot more of those people that just can't be found otherwise.
Could I follow up with that?
Yes, please.
One thing we discovered too, and we weren't able to or to be able to do this on outreach, but when Paul and I do our housing resource, we ask people where they stay when they're not at Metanoia. And many of the people that come in, they're riding the buses, they're in abandoned buildings. Those are places where we cannot connect with them for obvious reasons. But they are coming into Metanoia and sitting down doing resources with us. So it's really providing an opportunity to reach a population that even with our most strenuous outreach services, we're not reaching, especially, and there's more and more folks that we're seeing in abandoned buildings.
So in terms of the, you stated many of them have experienced severe trauma. Do you have any kind of programming or anything that involves them getting help, professional help?
Sure. I'll address that in a little bit of a bigger picture way. I'll add a little something personal. I've been following a rehabilitation model for a number of years, 12 years, because I have a sibling who has a serious mental illness, schizoaffective disorder. So he has psychotic episodes, and he's also had a lot of trauma. So for a long time, I have been following this psychosocial rehabilitation model in hopes that it could maybe help him improve. It never ended up being something that worked for him, but it has, almost by accident, become what we have implemented here within these satellite centers. I have a lot of literature to back it up that I'm happy to share, and I think could be beneficial to share with all the providers of homeless services in the area. What we're looking at as, I mean, we can call it a cause or we can call it an effect, but one way or another, people are experiencing trauma, severe trauma. Just one story is Pete, not his real name, but he grew up spending 4 or 5 days at a time during his childhood, ages 4, 5, and 6, in a closet with a bucket to urinate and defecate in. And because of that, he doesn't want to stay in a large shelter. The smells bother him. The cramped nature bothers him. That's trauma. That's the kind of trauma we're talking about. We're not talking about big trauma. We're talking about little trauma. We're talking about big trauma. So what this psychosocial model does is actually, so we find that trauma can bring about severe mental illness and psychosis. This is the only thing that has actually brought people to recovery, meaning that they don't need to take a medication to be without symptoms. This is a 32-year longitudinal study that has shown that 61% of people who've experienced severe trauma or have experienced severe mental illness have actually recovered from. Doesn't work for everybody, but what this model does is provides 3 things that are necessary to it, and it's all a part of the program. It is peer-to-peer support. It's also job skills and community skills training, and it basically means that people are learning how to be a member of a community from either each other or from a skilled staff member. The benefit to it is that it does not take a licensed social worker to facilitate. We see that with a lot of our smaller, low-resource nonprofits, is that they don't have the funding to pay endless caseworkers. So we're not a case management model, although they do work. This model is a therapeutic rehabilitation, and the data shows that the interventions that occur are the outcomes based on psychosocial rehabilitation interventions are greater based on the length of the intervention. So when we're having people overnight for 12 hours a day for a full 6 months, that means that we've introduced a full 6-month intervention to them, whether they've asked for therapy or not. It's still a rehabilitation.
So if I may just follow up that, we do have counselors that come into Metanoia that are there as people want to talk with them. You know, that they're just there, and it's an invitation for our guests to, if they want to see them. But Megan's absolutely right. For a lot of the people that Jim and I are used to seeing, the people that are, you know, currently sleeping out on the street on Prospect as I rode my bike over here, it first has to start with the relationship. For them to even get to that next hurdle of the idea of, okay, I want to do something different with my life. I want to get mental health treatment. I want to get rehabilitation from drugs and alcohol. I want to get into housing. It starts with recognizing them as human beings, affording them dignity and respect, and empowering them to make decisions not only about themselves, but about the other people around them. So we do have the services in place to address the variety of needs that the folks that come to us have, but it first starts with trust. It first starts with conversation.
All right, any questions from the committee? Councilman Jones.
Thank you, Madam Chair. So if I understand, you have individuals who actually go out and find those who are on Prospect or in the community and bring them, encourage them to come back to
Well, all year round, we go out, Paul, well, we have a whole network of outreach.
Excuse me, sir, can you speak into the microphone, please?
On Monday, Wednesday, and Friday mornings from 8 till noon, yeah, we know Bryant, who's staying out in the doorway here. We're working on a application for housing for him. And we take, we have an outreach nurse that comes out on Monday mornings with us. And we basically go to all the campsites. There is a network of volunteers and professional folks, which is run through NEOC. We have monthly meetings where we have a roster of folks who are at campsites, where we're able to identify if somebody's moved on, if there's new locations, if NEOC gets calls, they call us right away and we go out and try to visit that person, no matter where they're located. You know, certainly we focus mostly on the Near East Side and Near West Side, but we'll go to Euclid or wherever we get a call. And based on those relations, that to me, in my opinion, is the foundation of the Metanoia Project. We are seeing those people all the time. And when we first opened up those 40 people, most of them were folks that we had seen over the years who, you know, wouldn't go to the shelters, but came in based on those relationships.
How many individuals do you have doing that outreach work?
Well, for Care Alliance, there's myself, we had another outreach worker, he just left. So Care Alliance has one street outreach worker. Frontline Services has the PATH program, which I think consists of about 6 workers. Then there's a host of volunteer organizations that go out at night, which we communicate with. And for example, if St. Ignatius goes out on Sunday nights with their LABRA program, and if they find somebody who is looking for housing or wants treatment or needs medical care, they'll call us that night, you know, and we'll go out the next morning and see that person and try to follow up. So a lot of it's based on the relationships and also communicating and networking with other organizations.
How successful have you been in engaging? What percent, if you could put a percentage on?
Can I put it this way? I mean, I stick around because we see these little miracles that happen, and we see them fairly frequently. And the more we do this too, it's about being present to people, you know, and I think when we do that, those miracles happen. But when we force ourselves or force somebody to either make a choice, are you ready or you're not, and then the relationship, then we don't see those opportunities of people really moving on. And I learned that early on. We go, you know, there's people on the street due to their illnesses and addiction who could be housed, but they're not ready. But it's about, but we still want to care and be compassionate with that person. And when we do that, there's a time when they become ready.
Can you put a percentage on your number of contacts to 1 out of 10, 50-50?
I'd say, I mean, over the period of time, like, I'd say 30 to 40% of the people that we engage regularly, at least, have made some kind of transition. Yeah. I mean, the people that we saw, some of the people we saw a year ago are still out there. Many are not. Many have gotten in with the permanent supportive housing, the Eden program. That is, we're very much involved with them.
Mm-hmm.
Councilman Jones, if I may follow that up, you know, as a relation-based approach, you know, it's hard for us to think in percentages. I understand, you know, that's the way of the world as far as allocating money, but I just want to share a brief story with you about a gentleman that Jim and I have worked with. His name is David, and this will kind of allude to why it's so hard to say, okay, we've quantified these numbers. David, you know, I've known him for at least 6 years, probably even longer. And the first few years, David would not even really come out of his tent. He just kind of stayed put. Eventually, through our continuing to quote unquote knock on his door, continue to show up at his campsite, he eventually started to engage with us. But even in the worst of weather, he would not seek shelter, whether it was Metanoia or whether it was at any of 2100 or City Mission. This went on for a couple of years, but we kept showing up, every week, every other week. And eventually, David, when we had a bout of polar vortex somewhere 4 years ago, we invited him to come to a hotel. Okay, you don't want to come to Metanoia, we'll put you up in a hotel because we don't want you to suffer out here. And he agreed. And the following year, same kind of scenario happened. We had a cold spell, invited him to come into the hotel. He agreed. He stayed. The first time he stayed, first year he stayed was just for a weekend. The next year we had a long stretch of cold weather, 2 weeks. He stayed in the hotel the entire time. The year following, he came to Metanoia, and he was with us pretty regularly. And then finally, through 6-7 years of effort, last year, David got the keys to his apartment and has been staying over in the Detroit Shoreway ever since. So we think of, it's about efforts. It's about continuing to show up, looking for numbers, as I said before, while I get it from your perspective, it's really hard to quantify those. We just keep showing up, and we see a lot of success in that, a lot of people making that transition, but it starts with the relationship and not quantifying where they're, what we've done, what we've accomplished in our Friday outreach.
I'd ask the council to think of a pyramid. It took many visits to get those first 40 individuals to trust to come inside. So there was a lot of work on that. It's a low percentage. But once that base is built, then you raise the people up. Now inverted as well, because each time we put someone at the top of the pyramid, they have the potential to then raise other people up. And that's what we're learning through the satellite model. The ability to apply this model Megan was talking about, 2 or 3 workers on 12 or 15 people, and a constant every night, every day, 12 hours, they're coming up exponentially faster. And the numbers behind their successes were exponentially better. And that's what we're seeing. The groundwork's been laid. We really are excited about the results we're seeing. We can, and we'll provide you in a few minutes some of those statistics for you to look at later. But it really does take. It's like moving the car. One person behind it pushing it without the engine on. But once it gets going, it's a little bit easier to push, and that's what we're seeing and where we're seeing our successes.
And we're keeping people from freezing to death during the winter.
Last question, Madam Chair. Tell me what the $100,000 will be earmarked for.
Roughly, 1 second. We're spending about $2,000 per day to ensure that each person, about 110 people, A, are not freezing to death, but B, are benefiting from this therapeutic process. The shortfall, the $100,000 shortfall that we have, and added expense to what we've been doing in the past will be about $70,000. It will all go towards direct program expenses, but it will be about 1/3 transportation expense. We're spending about $75 a day, just transporting people for 150 days, which we didn't have to do before. And we're having to have additional staff at both centers, but also managing the operations between the two. So we're spending about $60,000 more on staff this year. And then we are needing to spend about $12,000 on equipment to launder our blankets that people sleep with. In the second facility, we have to put a washer and dryer in there as well, just to make sure that everybody has a clean blanket to cover up with. Essentially, there, $4,000 or $5,000 are getting spent on food, paper, that kind of thing. Is also involved, and I have a much more detailed budget breakdown if you'd like to see it.
I'd like to mention too that at least a third of our staff are formerly homeless folks who have made some significant changes and are now working for Metanoia.
Councilman Miller?
I just want to comment that it's important to realize that the programs that we at the county have don't meet everybody's needs, and I don't think that's any fault of ours. I think it's that people are very different, and some people can be accessed one way, and some people can be accessed another way. There's different ways to start a relationship, and some people really need something that's less formal, more personal, and creates an alternative path of entry. And I think that's what Metanoia does, and it's very important that we gain the benefit of using both our programs and this program. I think they complement each other, and it's very important that we do both. And I think the world has changed, and the Malachi facility is just not able to accommodate 110 people in one facility, and that we have to work with Metanoia to develop a new model that meets the need using multiple facilities. Thank you.
Fundraising tonight. All right, any other questions from the committee? Anything else you guys would like to share?
Thank you.
But here's some paperwork I can either give to the clerk or.
Clerk, and she will make sure that we have it.
Thank you for giving us the opportunity to speak here today.
Thank you for meeting with me and Councilman Miller. So we understand the need, and we felt it was very important that you guys shared that with the rest of the committee, as well as those individuals that are listening live stream. So we had a bank person in here. So I'm just trying to say, we had someone here that was from the bank. So if you're here and you want to donate some funds, you've just heard a heart-wrenching story. So I would like to bring up our next presentation, Senior Transportation Connection. Whoever is going to present for that.
Good afternoon, Madam Chair, fellow committee members. My name is Julie Rittenhouse, and I have the pleasure and the privilege of serving as the chair of the Board of Directors for Senior Transportation Connection. On behalf of the board, the STC staff, and most especially our writers, we thank you for the opportunity to present this afternoon to the committee. I am joined by fellow board members. I'd like to ask them to please stand and be recognized. A few had to leave.
Okay. Thank you and welcome.
Thank you. You will also hear from our Executive Director, Janice Ziegel, Lyndhurst Mayor Patrick Ward, Board Treasurer, North Olmsted Mayor Kevin Kennedy, past board member, and Clevelander Mary Lightfoot, member of the STC Passenger Advisory Committee. Senior Transportation Connection, STC for short, prides itself on being more than just a ride for the thousands of Cuyahoga County seniors who rely upon us for accessible transportation. The mission of STC is to provide affordable, quality transportation to enhance the independence of adults age 60 or older and people with disabilities. STC contracts with 27 municipalities, including Cleveland. We are an RTA paratransit subcontractor. We provide free transportation to medical appointments for the Cuyahoga County Division of Senior and Adult Services. We provide transportation to 5 senior meal sites in Cleveland and East Cleveland. They are operated by the Benjamin Rose Institute. Last year, our 60 vehicles completed 145,000 trips across the county, serving 12,000 seniors. There are additional statistics available in the folders that were distributed for your review. We have made a request to Cuyahoga County to support STC with a $100,000 annual allocation for 2020-2021. We are here today to make a compelling case for support with an update about our services, including the challenges that STC faces. STC is a genuine public-private partnership that was incubated and continues to be nurtured by the county from its inception. We have a proven track record, 15 years, of providing coverage that works and is convenient for both seniors and municipalities. Thank you, and I would ask our Executive Director to join.
Julie. Members of Council, thank you for the opportunity today. What would Cuyahoga County look like without STC services? Without STC, transportation would be fragmented, impeded by local borders. It is duplicative with each community staffing to schedule, take calls, and build routes. This wastes resources. STC spends $320,000 annually to maintain one central call center that serves 27 cities and each service agency that uses us in a daily service. Without STC, caregivers are burdened. These are working age adults whose own health and professional lives suffer without support. We also see more 65-year-old adult children in a household caring for their 85-year-old parents. About half of our passengers are African American, and 2/3 of them are low income. Family caregivers are predominantly women, so our service helps ease the burden for those who already face many disadvantages. Without STC, it is harder to access health care. 90% of Cleveland users rely on us to get to medical appointments, chronic disease management, and the wellness programs our hospital systems currently promote. The key to that wellness is consistent, reliable transportation, and STC guarantees that access. Mayor Ward and Mayor Kennedy will address you shortly and provide their perspectives, but I'd like to introduce you to one of our customers. Mary Lightfoot is on our Passenger Advisory Committee. She and her late husband are also consumers of STC services.
Thank you. Thank you for the opportunity to tell you about Senior Transportation Connection and my experience with this wonderful organization. My husband learned that he had advanced COPD in 2004. To say it was a shock is an understatement. We had always been very active in activities in the area. Neither of us drove. We always used cabs or RTA or walked. We walked to the theater, we walked to the sporting events, restaurants, etc. We loved living downtown because of the easy access to these events. And trust me, we didn't miss much. We refused to believe that our lives needed to change because of his disease. It didn't really enter our minds for a few years. However, as the disease progressed and the medical equipment needs progressed, we realized the need for life changes. The oxygen-holding walking cart was replaced by an oxygen-holding wheelchair, which was replaced by an oxygen-holding motorized wheelchair, all in addition to the oxygen nebulizer for treatments and a CPAP for sleep. Fred had researched and found STC on the internet. He contacted them and we were quickly approved. Our original need was medical, doctor's appointments and physical therapy appointments. They were accommodated beautifully. Then we found that we could use the service for more than medical appointments. So we began our twice-a-month trek to the West Side Market. Eventually, we made it a point to schedule the rides to include lunches. Great Lakes Brewery, Market Garden Brewery, and the West Side Market Cafe became our luncheon destinations. These treks eventually became Fred's main social events. He looked so forward to them and he smiled. I'm chronicalizing these events to let you know that without STC, he would have been isolated in our apartment most of his waking hours. And since we are social animals, that would have been tragic. We did take walks if the weather was permitted, but STC gave him a purpose and made his life happy and active. I would hope that other seniors would have the same opportunities to socialize with the outside world, and STC can be a vehicle to this end, pun intended. Statistics say that we are a graying society. 67% of seniors surveyed in a survey a couple of weeks ago said they go 3 to 5 days with no contact with the outside world. Loneliness has become a way of life for them. We can help seniors communicate and remain an important part of our society with the help of organizations like STC. I thank them for their service, and I thank you for your time.
Thank you.
Good afternoon, and thank you. I'm Patrick Ward. I'm the mayor of the city of Lyndhurst. And in that capacity, I also serve as the president of the Council of Governments that oversees our Community Partnership on Aging, a collaborative of 5 municipalities that serve our 60 and older population. When we were just the Tri-City Consortium on Aging over 40 years ago, we decided that transportation was a critical component of getting our residents to the social activities that were so important to their thriving and to shopping and to especially medical appointments. But that was not a sustainable model for 3 communities to handle, and the vans would constantly break down, they were hard to replace, and budgets were tight. And then STC came into vogue, and we found this wonderful facility for us to provide a more robust service to our residents, to see that they got to our communal lunches, to see that they got to their shopping trips, to see that they got to their medical appointments, and most importantly, did all of that on time, on schedule. There's nothing like STC and the reliability that it provides. I hear that continually from my executive director of our Community Partnership on Aging, and especially from our resident users that utilize those services. Any of us who were present at the stakeholders meeting for Metro Health earlier this year heard Dr. Boutros talk about the dynamic shift from being a center for medical care to a center for health. Health is very important, and that sentiment that he articulated there has been echoed by the other two major hospital systems, which we are so fortunate to have such world-renowned medical systems in our locale. But becoming centers for health means accessibility. And STC is the vehicle for that accessibility. There is nothing like getting our residents to those needed medical appointments on time. Older people, as Representative Conwell and I spoke about earlier, are the last ones to want to ask for help. But having something that is not inconvenient, that doesn't inconvenience the children, that doesn't inconvenience friends, having that vehicle available to them has become so important. And so our continued support of STC is equally important. And I thank you tremendously for having us here today. Thank you.
Thank you, council members, for having me here today, and I'm honored to speak on behalf of the STC. By way of introduction, I'm Mayor Kennedy. I've been mayor for the city of North Olmsted for 10 years and council president before that. And North Olmsted Commission on Paratransit was one of the first organizations of its type offering affordable regional transportation services to seniors and those with disabilities. Originally serving North Olmsted, Olmsted Falls, and Olmsted Township, started in the early 80s. Its influence spawned other transportation agencies' models of success. STC was founded when several Cuyahoga County transportation providers began meeting informally, exploring coordination and shared services, including North Olmsted Commission on Paratransit and other regional providers. The informal collaborations became official on February 5th, 2005, when STC was incorporated as a not-for-profit organization. So this has been very much a regional thing from the very get-go. In North Olmsted in 2018, we had STC provided 3,731 trips, which includes nutritional meals, education, doctor's appointments, banks, pharmacies, and much more. These trips are not just fantastic for our seniors and our disabled, but it's great for commerce and small business in every city. Not only is it a great service for our seniors and disabled, but I can speak to this as a father of 8, and having a mother that's disabled. I often, myself and my sisters are challenged with taking my mother places, and we love to do that, but sometimes there's a kid's football game, a track meet, something that you have to miss in order to do that. And that's where things like STC come in, and there's plenty of seniors and disabled that don't have a family around them. It's also very important to say that, look, as a mayor, I try to engage my seniors because I realize that there is the temptation to sit around and say, well, I don't feel that bad. I don't need to go to the doctor. Well, I don't really have a way there. So we as a city engage the residents, but it's very important that STC is around to make sure when we engage them, they have a way to get there. There is of course an alternative to senior transportation like this, and that is if they're not engaged, it's from ambulance to hospital. And we want to avoid doing that. And let me share a story with you. It's Linda's story, but it's similar to many stories of seniors. Linda began riding STC nearly 3 years ago. She has multiple vision problems that prevented her from driving. After raising her family and working in customer service and medical office positions, Linda retired, single and on her own, like many other adults. She explained, "I didn't want to just sit at home, so I joined the North Olmsted Senior Center," she explained. I noticed information about STC in the newsletter, and a couple of other ladies at the senior center ride the STC all the time. They convinced me to let someone else drive. In addition to joining the knitting and crochet group at the senior center, she enjoys lunch 2 times a day. I go out with the Red Hat group. I have a group of friends who all go out to dinner once a month, she said. I do more socializing now than I ever have. Linda's story illustrates how important STC is to combating social isolation, having healthy meals with friends, and participating in the community. It's also a reliable and comfortable solution for older adults who should no longer be driving. And I want to thank you for the opportunity.
I will be brief in my conclusion. STC faces big financial challenges. As a nonprofit, our vision has been committed public-private partnerships and affordable service. Historically, about 80% of our operating revenue has been sourced from earned income. Changing market factors make that affordability a struggle, and we need your help. Our original model employed drivers retired from other careers who look for something meaningful. They are willing to work for the intrinsic rewards of a helping profession. However, our drivers are professionals who deserve better wages. They take pride in safely managing a wheelchair, reacting properly in a medical emergency, and driving across the county in all kinds of weather and traffic. We must increase the wages to keep competitive in this lower unemployment environment, so STC drivers are the best drivers, delivering the customer service our seniors deserve. Funding has always been competitive, but fewer foundations support projects that serve older adults. United Way discontinued funding transportation this year, mid-cycle, a loss of $90,000 in operational support for STC. Quite frankly, there are not a lot of new sources to replace those funds. We must build capacity as our county population ages. As I conclude our remarks, I'd like to publicly acknowledge our individual donors. In addition to outstanding foundations who continue to support us, there are hundreds of individuals who contribute to STC too. They are passengers who sent checks, dropped a few dollars in the fare box when they got on the bus, and last year those citizens donated nearly $100,000. And we believe that their support is a testament to our value in this county. We respectfully ask the Cuyahoga County's 2020 and 2021 budgets match their efforts and help us ensure the future of STC. The $100,000 per year request is an investment in an asset that supports a growing segment of our local population and models a collaborative vision and discourages service duplication. Our passengers have already committed, and please join them in supporting us. Thank you, and we look forward to your questions.
All right, is there any questions for STC? Councilman Miller.
What is the relationship between RTA and particularly RTA Paratransit and STC?
Councilman, there's actually a long history with RTA. They were part of the steering committee that created STC as an entity, part of the strategic planning process. Early in our establishment, they served as an incubator for helping us get through processes like procurement, financial management, fleet management. Our relationship now is that we are one of 3 subcontractors for paratransit service, and we're actually the smaller subcontractor of those 3 relationships. We enjoy a very positive relationship with RTA, and we also know that the work we do in our community also impacts the work they don't have to do in terms of very expensive paratransit or specialized services.
Am I correct that being a subcontractor for RTA, that's only a part of what you do?
That is absolutely just a part of what we do.
That most of the rides you provide have nothing to do with RTA, that it's a separate system.
Those are our community routes, the 27 communities that we serve.
And the funding that you requested for 20 to 21.
Yes.
If we provide this funding, do you think that over 2 years that you could find replacement sources to fill this gap, or do you think the $100,000 per year is going to need to be a permanent county commitment?
We would hope it would be permanent, but I would also add that STC is being very strategic in looking at our community contracts to make sure they are sustainable, to make sure they are profitable. Just prior to this meeting, our finance committee met, and we had a very healthy discussion about how we work with our community contracts to make sure they're sustainable. We're also looking at our own efficiency to make sure we're putting multiple people on vehicles. We're co-loading, and we're making those routes as efficient as possible. Part of the investment that the county will make will help us with that technology to make sure we're very smart in how we're delivering our services.
Councilwoman Brown.
Thank you very much. I was just curious, I was under the impression that the county already provides funding.
The county provides funding through the options program, which is a per trip, and it is limited to medical. And those individuals must qualify for eligibility under the county program.
Okay, and do you receive the funding that you receive from the municipalities? I'm assuming you receive money from the municipalities that you serve?
That is correct. So the way our model works is we contract with an individual community to serve the older adult residents of their community. And it's the municipality that pays the majority of the cost of that service. Often there's a small co-share or co-pay from the rider, but they are the cities that are contributing the bulk of the revenue towards the contract.
Okay, thank you.
All right, any other questions? Councilman Miller.
Is the city of Cleveland among the participating communities?
Yes, the city is one of our largest.
Should we say which ones don't? No. Okay, just thought a little humor would go. So you said 100,000, or did you just say a little over 100,000?
Our request to you is $100,000
Okay,
in each of those years, 20 and 21.
Okay. So this must be $100,000 day.
It must be.
All right, for 20 and 21. All right. Hearing none, we want to thank all of you for coming out.
Thank you.
And showing support. I know I've had a meeting with STC privately, so I thought it was very important that the rest of the committee members heard about the need and the good work that you do out there, and that everything goes up, and our seniors are living longer, and they're our parents, they're us, So, as good stewards of the county, we need to all take a look at this and where we could pitch in. So I want to thank you all for coming out today.
Thank you.
Thank you.
Madam Chair, for clarity, that was 200,000 over the 2 years, or?
Yes.
Okay.
For 20 and 21. And so to end any miscellaneous business, anyone signed in, all right, to adjourn, I'd like to just say today, we all kind of heard about the need for food for our fellow neighbors, because the need is continuing to rise and now touch some areas in the outer cores of the county. So we need to get a jump on that. We heard about unsheltered human beings that will be displaced because of overcapacity at one of the facilities that has opened their doors. And we heard about isolation and individuals being able to access the resources that the county provides, whether it's the food that, we have. So I think we should all go home tonight and think about these things and dig a little deeper in our pockets. Have a blessed day.